I would like to welcome you to my channel, That Middle-Aged Lady. My name is Denise, and in today's video, I wanted to talk about a controversy that surrounded a 2002 study that was conducted involving postmenopausal women who were on hormone replacement therapy. But before I get started, I just wanted to clarify that the information I'm going to be sharing in this video is not meant to take the place of any medical advice from your physician, nor is it meant to be taken as any medical advice from me, but rather is just my opinion and my interpretation of the events that took place during that time, and is meant to be more entertainment and for discussion purposes only. And so Premarin, a conjugated estrogen hormone replacement therapy, conjugated meaning several different estrogens combined together, was first approved by the Food and Drug Administration in the United States in 1942 for the treatment of those dreaded menopausal symptoms being hot flashes and night sweats. It was manufactured by a company called Wyeth, W-Y-E-T-H, out of Philadelphia, Pennsylvania. Although it was approved for treatment in 1942, it wasn't until the 1960s when it became widely popular during the feminine movement, and especially after the book Feminine Forever had came out with the author Robert Wilson claiming to women that they no longer needed to suffer with those horrible menopausal symptoms and could take back their life with simply one pill. Needless to say, women flocked to their gynecologists like crazy to be put on this new miracle drug, and sales went through the roof. Unfortunately, when something sounds too good to be true, usually it is, and by the 1970s, some research had came out to show that women who were taking estrogen alone had a higher risk of developing endometrial cancer. And so because of that, this caused a lot of women to go off the treatment, causing the sales to plummet. And then a little while later, more research came out saying that if a woman with a uterus was on an estrogen hormone replacement therapy, she also needed to be on progesterone as well in order to lower her risk. And so once again, women were being prescribed this like crazy, and sales once again rose. Then in 1988, the Food and Drug Administration approved the use of hormone replacement therapy for not only those menopausal symptoms like hot flashes and vaginal dryness, but also to help prevent heart disease and osteoporosis as well. And so you can imagine when women heard that, they once again flocked to their gynecologist to be put on this, amazing medicine. And by 1992, Premarin had become the #1 drug prescribed in the United States. And then by 1997, according to what I've read, their sales supposedly reached over $1 billion. What's funny to me is I can remember in the 90s when I would have been early to middle 20s, and my mom, who had had a hysterectomy in her early 30s, was actually on Premarin. At the time, obviously, I had no idea what it was, but once I started doing research for my videos, it rang a bell, and that's when I remembered her being on it. So I just thought it was funny that my mom also was part of that group of women who were sold on the ideal of how wonderful Premarin was, and that my mom was part of, those millions of women who were on it. I'm sure you're probably asking yourself by this point, so where's the controversy? The controversy began in 2002 when the Women's Health Initiative, WHI for short, had conducted a study to see the effects of breast cancer, colon cancer, osteoporosis, and heart disease within postmenopausal women, and to see if there was anything that could be done to help lower the risks of getting those particular conditions or cancers, and most importantly, to prevent any woman from dying from them. According to an article I found online by the Office on Women, and I will link that down below in the comment section, the study was funded by the National Heart, Lung, and Blood Institute. It started in 1991 and was one of the largest prevention studies ever done in the United States. That it ended up costing over $2 million. It involved over 160,000 women who were ages 50 to 79 years old, and was supposed to last for 15 years, but ended early due to the World Health Initiative finding that using combined estrogen and progesterone in postmenopausal women raised a woman's chance of getting heart disease, stroke, blood clots, and urinary incontinence, and it further cited that it also increased a woman's chance of getting invasive breast cancer. This led them to believe that using hormone replacement therapy, such as Premarin, was actually more detrimental to a woman's health than it was beneficial, And because of this finding, they ended the study early for the safety of not only women who were using the Premarin or other hormone replacement therapies, but also because of the women who were included in on the study. They just didn't feel that it was safe for them to continue on. Once the results of the study were made public and women learned of it, it unleashed this mass hysteria from women who were afraid of not only what was going to happen since they had been taking the hormone replacement therapy, but the fear if they continued on taking it, how much more would they be putting themselves at risk? Doctors also became reluctant to want to prescribe it since obviously they didn't want to put their patients in harm's way. And because of this, sales plummeted and Wyeth was estimated to lose supposedly billions of dollars. There is just so much to unpack here that I could never do it all justice, nor can I remember it all. And so if you feel like you want to learn more about it, you can always look it up on the internet. I can guarantee there will not be a shortage of articles, and you can also talk to your doctor about it if you're interested in getting more information about it. But after the other studies came out, after the 2002 study, it was determined that that 2002 study was tainted because they never told the public that a lot of the women in the study were over 60 years old, 63 was the average age, and had been postmenopausal for over 10 years. And apparently that already raised their risk of getting some of these conditions. And so there were variables in this study that should have been taken into account because it could have, played a role in why it wasn't necessarily accurate. And they felt as though it was scaring women unnecessarily and causing them to go off their treatments when some of these women truly needed them. I kind of equate this to the California gold rush, where everybody was rushing out trying to find their piece of gold on the promise that they would be able to. And in this case, postmenopausal women were being sold on the promise that not only was this miracle drug safe, but it could help to combat those menopausal symptoms like hot flashes, night sweats, and vaginal dryness, and can also prevent heart disease and osteoporosis. And so what woman wouldn't have wanted to go on it? And that was the problem, was that it was being overprescribed, and sometimes to women who really had no business even being on it. And then you had the doctors who felt good about the fact that here this was this miracle pill that they could prescribe to their patients and finally give them the relief that they were seeking. And then of course you had the pharmaceutical companies that were making billions of dollars off of it. And so, the way that everybody looked at it, it was just a win-win for everybody. At the end of the day, it was the postmenopausal women who were on this hormone replacement therapy that suffered the most, since here they were promised this miracle pill that could help with their menopausal symptoms and prevent heart disease and osteoporosis. So millions of women jumped on board to get on this treatment, and I'm sure it probably helped a lot of women as well, only to then be told, oh no, it's detrimental to your health, nobody should be taking that, or it's going to raise your risk of getting all of these different things. So all these women went off of it, probably a lot of them who really needed that treatment. Then a short time later, another study comes out that says, oh, no, don't believe that study, it was flawed, and there were variables in there that weren't ever reported, so it's okay, it's safe for you to go on it. Obviously, it's going to leave a lot of women to wonder, which is correct. Is it safe? Isn't it safe? Even to this day, many years later, there is still that black cloud that surrounds the use of hormone replacement therapy, leaving a lot of women to wonder exactly how safe it is to use. The next chapter to this saga would be when there were several different class action lawsuits brought against both Wyeth and Pfizer, who acquired the company in 2009, claiming that they misrepresented both Prempro and Premarin by telling women that it would lower their chance of getting cardiovascular disease, Alzheimer's, and dementia. Plus, they never mentioned the fact that it could increase a woman's chance of getting breast cancer. And so a lot of these class action lawsuits were won. Some of them were settled out of court just so that Pfizer and Wyeth didn't have to admit guilt. They didn't want to ever admit guilt, God forbid. And then some of them were dismissed. And so I don't have a number of how many women claim to have developed breast cancer or had a heart attack during this time, but I have to believe it must have been a lot of them in order for a class action lawsuit to have been brought against both of these companies. There has been a lot of research done since then, and I feel like physicians know a lot more now than they did back then. And one of the things that I have read continuously, and even my own physician, my own gynecologist told me this after I was put on Vagifem for my vaginal atrophy, that the least amount of estrogen you're on for the least amount of time is always safest. And so, like in my case for the vaginal atrophy, You start off with one pill a day for 2 weeks, and then you go down to one pill twice a week. But my doctor told me if you can even take it further than that, if you can go down to once a week or once every other week and still get the relief from your symptoms, then do that. Because the least amount that you're on is always going to be safest, even though the vaginal, different treatments for vaginal atrophy, the tablet, the creams, and the ring are said to be ultra low, and very little of it actually makes it into the bloodstream because it all stays pretty much targeted to the vagina. But, even in that case, even though there aren't really a whole lot of safety concerns that come with it, my gynecologist still said the least amount of estrogen for the least amount of time is best. Another thing I came across quite a bit in a lot of different articles was that any woman who is over 60 years old and has been postmenopausal for over 10 years and goes on a hormone replacement therapy after that time is at greater risk to develop things like breast cancer and dementia. Now, take what I say with a grain of salt, since I can't guarantee 100% how accurate these articles were, but not only was that something that came out in the 2002 study, but again, I have read in countless articles. And so if you happen to fall into that category and you're 60 years old or older and have been postmenopausal for over 10 years, whether you're about to start hormone replacement therapy or whether you've been on it, I would definitely, check with your physician and just find out how safe it is and see if there's anything that maybe can be done to reassure that you don't fall into that category of being at a higher risk. I think the bottom line here is that there are always going to be risks with just about everything in life, including hormone replacement therapy. And as long as there is research being done and studies being conducted, I feel like there's always going to be changes to the guidelines, and there's always going to be things that are going to be different than what we were told before. I think about that in terms of different foods. I can't tell you how many studies, and I'm going to use broccoli for instance. A study comes out and says, oh, broccoli is wonderful for your health and you should eat, at least a cupful of broccoli every single day. And then the next study comes out and says, oh, no, that study was wrong. Broccoli is not good for you and it can lead to this, this, and this. And you really need to limit your intake of broccoli. And then yet another study comes out that says, oh, wait, that second study was wrong. The first study was correct. And we have found that broccoli actually is good for you. And so trying to keep up with all of the different guidelines seems nearly impossible. And so I just think it's important that we get to a point that, number one, use our common sense. If it doesn't seem right, then chances are it isn't. I think it's important to do our research and to arm ourselves with as much knowledge as we can so that if our doctors go to tell us something or, we want to ask questions about something, at least we'll know what they're talking about or what we're talking about. One of the most important things I think that any of us can do, regardless of whether we're on hormone replacement therapy or not, is to stay proactive. Go for those mammograms, do those self-breast exams, go for those pap smears. And if you notice any changes or something that doesn't seem right, don't wait, but rather go right into your doctor and have that looked at. I can't tell you how many friends I've had and family members that one friend I had uterine cancer, another had colon cancer, another one had lung cancer, and they all waited too long to go into the doctor. And by the time their symptoms got so bad that they felt like they were forced to go, it was too late because the cancer metastasized. And unfortunately, all three of those friends or family members of mine have since died. And so if there's one thing that taught me, it's that time is of an essence, and it's so important not to procrastinate or ignore different signs or something that doesn't feel right. I just think that's probably one of the most important things we can do, since the majority of cancers out there are a lot better to treat or more treatable the earlier you find them. And so I think that is one of the most important things that we can do. In my case, even though I know Vagifem is supposed to be safe to use, according to what my gynecologist has told me and everything I've read, you are at no greater risk taking it than you would be if you weren't taking it. I can't help every time, I feel a little bit of pain or discomfort in one of my breasts, my first thought is, I wonder if that's caused from Vagifem. If my lower back starts to hurt, I wonder if that's caused from Vagifem. If I have a headache, if I'm constipated, if I'm having a hard time sleeping, if I have no appetite when I wake up, my mind automatically wants to go to, I wonder if that has to do with Vagifem or something that Vagifem is doing within my body, which is ridiculous because, well, before I ever went on hormone replacement therapy, I would feel little discomforts in my breast. I would get headaches, I would get backaches, and so on and so forth. But because there are these risks that are drilled into our head with taking hormone replacement therapy, I think that's where all of our minds always naturally want to go. And I think that stress and worry can do just as much harm to us as anything else. And so in my case, after a year, I will stop taking it. I am going to give my body that break, which is the recommendation. I will hope that my symptoms don't come back anytime soon. But if they do, I figure I'll cross that bridge when I get to it. But I am going to follow that guideline because I do think it's important. And so before I end the video, there is one other controversy that I discovered around Premarin. It's nothing health-wise, nothing that says a woman shouldn't take it, nothing like that, but it is something that I found interesting and, if true, a little bit sad. And so that's going to be the next video I'm going to upload. I think it's funny that when I started doing the research for these videos, I didn't know about any of this. And the more I dug, the more I found. And so there's a lot of controversies out there that obviously I don't think any of us are even aware of unless you're truly looking for them. And so I appreciate the fact that I'm able to share these different things with other postmenopausal women and that we're able to share our experiences with each other. And I hope that, you find these topics interesting as well. And as always, if you have any comments or questions, please feel free to leave them. I'll be happy to answer any questions that I can. And other than that, I want to thank you so much for supporting me and for joining me today. And I will look forward to you joining me for the next video.